Well, Dr. Steve and I, we have the pleasure of introducing our next speaker. And as we were speaking about this morning, we were able to finish out last year with 43 clinical studies, tremendous achievement, and we're not done yet. And each time we do a clinical study, it helps us learn more about our products, better ways to use them, and then also development of new products for the future. And we're very fortunate, and again, this could not have happened if it wasn't for the network marketing industry. One of our members here, Dr. Quila Ryder, if you could give her a big round of applause. Was kind enough to introduce this gentleman to LifeWave, and it got him interested. And I think that followed with you making a call to him.
Right, and it's my honor to introduce Dr. Norm Shealy. He is world-renowned. He is a neurosurgeon. He's been doing, he's on the forefront of integrative medicine for 42 years. He has published numerous papers in scientific journals. He lectures all over the world, and he is a fabulous human being, which I know that you'll find out in just a few minutes. So thank you so much. Norm, can you come forward?
Thank you. It's really a pleasure for me to be here. And first of all, I want to thank David and Dr. Steve for inviting me and coming to visit me a few months ago. And of course, Quila for introducing me to the concept. And I said, well, look, I'd be interested in doing some research on it, because my idea is, David and Steve's, is you want to prove that there's an effect. And so we talked about what might be my favorite, and I thought about insomnia because of silent nights. Because in many respects, insomnia is one of the causes of many of the diseases, as we'll get to in just a moment. But I want to go back just a moment and talk about how I got into looking at the vast array of possibilities that are not drugs or surgery. When I finished my neurosurgical residency at the Mass General Hospital, you're supposed to bow to the east at the very mention of the place, I was convinced that what we were doing was worse than witchcraft. We were cutting spinal cords. We were destroying parts of the brain to control pain. And I wasn't sure whether the surgeons or the patients were crazier for doing this. And I set out to try to find a way of controlling pain without destroying the nervous system and without drugging the people. And that led me, in the mid-'60s, to developing something which is pretty well known now called transcutaneous electrical nerve stimulation, or TENS, and dorsal column stimulation, which was an implanted electrical stimulator. And then I was seeing hundreds of people every year who had failed everything. And I wasn't selecting 94% of the patients who were sent to me for anything I had to offer, because I thought they were too damaged to try any of my approaches. So that's how I really went out on a twig and began looking at what else we could do. The next major innovation in my own approach to this was about 16 years ago, when I was invited to go to Kiev. Now, you got to understand, I thought Reagan was correct, that this was the evil empire, it was just after the fall of Russia. But I couldn't resist, because they were doing nanotechnology. And I went over and spent some 12 days learning what they call microwave resonance therapy. Wow! They were treating everything with it. I actually treated an ex-communist boss for his peptic ulcer. And they were talking about applying human DNA frequency to specific acupuncture points and, quote, curing. They use the word looser than we do. But for instance, they said that they had a 92% cure rate for 6 to 24 months with just 10 treatments. And so I brought that back to this country and began working on it, and basically I've concentrated on that. So that 6 years ago, when I finished some of my research, I wrote a book called Life Beyond 100, Secrets of the Fountain. And David, I only thought about living to 150 years. So I've got a new goal to think about now that I've met David. Interestingly, then, when Quila introduced me to this product, I thought, well, insomnia really is the biggest problem for many, many people. The average American sleeps 5.5 hours. That's average. And they don't even consider that insomnia. 200 years ago, the average person slept 10 hours. 40% of Americans do think that they have insomnia. They're sleeping often less than 5 hours. And all major diseases are associated with chronic inadequate sleep. Now, how many of you sleep a minimum of 7 hours well? The rest of you should be using silent nights, because I am here to tell you that I was very pleasantly delighted to see the results that we got in this particular study. We actually chose 25, one dropped out, people with insomnia. And they were evaluated with 3 standard, well-accepted sleep questionnaires. The Leeds Sleep Evaluation Questionnaire looks at the quality of sleep. The Epworth Sleepiness Scale is daytime sleepiness, and the Pittsburgh Sleep Quality Index actually is the length of sleep. Now, we did a number of other things. We looked at whether or not they were depressed. We looked at the total number of symptoms they had. And we didn't find many changes. Interestingly, to my surprise, only about 50% of them were depressed. I would have thought, if it was me, I'd be stinking depressed if I was not getting adequate sleep. But many of them were not. They didn't seem to have a huge number of symptoms, which also surprised me, but all of them were chronic. I mean, we're talking about not weeks, months, years of problems with adequate sleep. So we gave them the instructions, and of course, those of you who know Silent Nights know that there are 5 specific points that the people may apply the patches to. And I just told them, until you sleep really soundly, you just go through the 5 different sites. And basically, they wound up, most of them trying all 5 of the points, and there was no strong preference. I mean, if you look at it across the board, it was 5 or 6 people using each of these points long term. The Epworth daytime sleepiness score decreased 72%. That means during the day, they reported 72% less sleepiness than before. That's very striking improvement. On the Leeds quality of sleep, they improved 80%. That's their assessment, depending upon this questionnaire, of how much better, not just how much longer, but how much better they were sleeping. And finally, the one that most of us would think of as the most important part of the test was the Pittsburgh, the length of sleep. That improved 88%. So if you took someone who was sleeping only 4 hours, and they're now sleeping almost twice that, over 7 hours average, this is better than any known drug in the world, and safer, with there weren't any negative effects, of course, in this group of people. Interestingly, of course, I then told them how to get in touch with Quila if they wanted to stay on the patches. Some of them have told me even weeks afterwards they were still sleeping better. Just that 1 month of using the Silent Nights had somehow reset their thermostat so that they were sleeping better. That's the slide that was going to be before.